So if we look at the genetic outline or the genetic spectrum of newly diagnosed patients, we see that one of the most frequent recurring mutations is NPM1. And in terms of prognosis, it seems that NPM1 confers a favorable prognosis, and we may not even have to transplant patients in order to cure them. The point is that it's quite frequently happening that NPM1 mutations come with other co-mutations, and we are not sure about the prognostic implications of these co-mutations. We know that when NPM1 has co-mutation with FLT3 ITD, the prognosis is not as good as without FLT3 ITD. But in the most recent classifications of WHO or the International Consensus Conference, the so-called secondary type mutations, which are gene mutations related to myelodysplasia AML, confer an unfavorable prognosis. And our question was, if these secondary type mutations co-occur with NPM1 mutation, do they again confer a less favorable prognosis, or does NPM1 overrule the bad prognosis of secondary type mutations? And for that, we did a large retrospective analysis looking at patients from the Study Alliance Leukemia study group and the AML cooperative group, and identifying around 800 patients with NPM1 mutations, and one group of them had secondary type mutations and the other half didn't or hadn't. And we looked at the prognosis, and we saw that the prognosis was similar between the two groups, which means in NPM1 mutated patients, secondary type mutations don't confer an adverse prognosis, but the prognosis is still good.